A lot of Americans are confused about public health, and that confusion has real consequences. It erodes trust in public health institutions, and it means people don't always believe the things that public health institutions tell them. Over the last year at the Beaumont Foundation, we've been conducting research with more than 1,600 people across the United States to understand what they understand about public health and how we can communicate more effectively about the work we do. Public health works at the community level. So when most Americans think about health, they think about health care. They think about what happens to them at a doctor's office or in a hospital, and that kind of health is delivered to you individually. So one person at a time, right? When you go to a doctor's appointment, that doctor's job is to think about your body, your health, right? Maybe your mental health, as well as your physical health, but one person at a time. Public health thinks about whole communities at a time. So we think about interventions, things we can do at the community level that can help whole groups of people at once, rather than solving health problems one person at a time. Public health focuses on prevention. So if we think about a healthcare model of health, we're thinking about solving problems after they've started, right? Usually you go to the doctor after you start to feel sick, or you go to a hospital once something is already wrong with you. When we think about public health interventions in a community, we're thinking about things that prevent disease from happening in the first place. These things are often behind the scenes and invisible. A great example is a food safety inspection in a restaurant, which ensures that the food that you eat is healthy before you even get there, so nothing bad happens to you on the other side. That work is also largely happens behind the scenes, so you don't see the restaurant inspector when you go to the restaurant, but you have confidence that what you're eating is going to be good for you because that restaurant inspector has been there. Public health is local. So a lot of Americans are familiar with national or federal agencies that work in public health. Those are organizations like the Centers for Disease Control and Prevention, or CDC, NIH, FDA, and other organizations like this. Those organizations and federal agencies are really important, but actually most of what happens in public health happens at the local level in the communities where you live. So every state in the United States has a state health department that thinks particularly about the health and the needs of the folks who live in that state. And most communities also have health departments. The folks who work in those health departments are people who live, work, and play alongside you. They're your neighbors, and their job is to go to work every day and think about protecting the health of the people they live with. Public health workers play many roles. Public health workers do a lot of different things. This is not just a single job. You can think about a whole range of things happening across the field. There are folks within public health who are epidemiologists, who think about disease surveillance, who spend a lot of their time looking at data from across the community. There are also folks in health departments and in the broad field of public health who spend a lot of their time actually out in those communities, right? Talking to students at schools, working in clinics, doing the work of community health workers. And there are a lot of people behind the scenes as well. So restaurant safety inspectors, water safety inspectors, all of these people are working together to protect the health of the communities that they serve. Public health benefits everyone. So public health isn't just for specific communities, and it's not a pay-to-play arrangement. Public health aims to help everyone in every community all the time ensure that they have what they need to be healthy and safe. Do you want to learn more about how to communicate effectively about public health? Visit our toolkit at debeaumont.org.